Hello there, welcome back to my channel. Thank you for always watching my videos. Thank you for always sharing my videos out. And if you are just seeing this face for the first time, I'm Tessie by name. You're welcome to my channel. So I want to talk on peptic ulcer in this video. What is peptic ulcer? Peptic ulcer is a sore that occurs in the lining of the stomach, okay? That is why it is also called stomach ulcer. Okay, so what are the causes of this peptic ulcer? Peptic ulcer is being caused mainly by a bacteria called Helicobacter pylori. Okay, it can also be caused by prolonged usage of what? Non-steroidal anti-inflammatory drugs such as ibuprofen or aspirin. So these drugs are good when it comes to pains, but using them without doctor's prescription or being on them for a very length of time can predispose one to peptic ulcer. Okay, another thing that can cause peptic ulcer is cancerous or non-cancerous tumors in the lining of the stomach, duodenum or pancreas. Okay, so these are the three major causes of peptic ulcer. So how does this Helicobacter pylori cause ulcer? It does so by damaging the protective lining of the stomach. Okay, so when it damages this lining in the stomach, it will now make the hydrochloric acid, that is the acid that is being produced naturally by the stomach, they will now have access to the sensitive line of the stomach. So by so doing, it will create sore. From there ulcer will develop. Okay, then another thing is, how does this non-steroidal anti-inflammatory drugs, how does they cause ulcer too? They do so by each human being produce two enzymes, and these two enzymes are the enzymes that are responsible for pains, inflammation or swelling, and fever. So these two enzymes, now one of them is also producing a chemical that protects the stomach. So when you are now taking these non-steroidal anti-inflammatory drugs to treat either inflammation or pain or fever, you see that you are decreasing the formation of this one of the enzymes that is also useful when it comes to protecting the stomach. So it now make the stomach acid, that is HCl, to have more access to the lining of the stomach. Okay, so you can now see how it is affecting the stomach indirectly. So whenever you are taking any non-steroidal anti-inflammatory drugs, always consult your doctors. Don't take them on your own, so that it's not after treating maybe inflammation or fever you now expose yourself to peptic ulcer. So that is for the causes of peptic ulcer. So what are the risk factors of this peptic ulcer? One is family history. There are some people that this peptic ulcer is just in their gene. Okay, so that one is a risk factor. It means that you have the chances of having this peptic ulcer. Okay, then another risk factor is, like I said before, prolonged usage of these non-steroidal anti-inflammatory drugs. Okay, then another risk factor is alcohol consumption. Okay, and smoking. So what are the signs and symptoms of this peptic ulcer? Generally, people that have this peptic ulcer, most of them don't have symptoms. Okay, but there are some signs that indicate that someone is having peptic ulcer, and one of them is burning pain in your middle or upper stomach. Okay, you always have these pains, like sometimes when you eat or in between meals, you always feel these pains. Okay, you also have bloating. Some people, they belch regularly, as in gas. They always belch fast, because of accumulation of gases. Okay, so another signs of this peptic ulcer is nausea. Some of them, they feel like to vomit but they cannot vomit, and some do vomit too. Okay, so these are the signs. Whereas in severe cases too, okay, in severe cases in this peptic ulcer, some do experience weight loss. Like when you see people that have this ulcer, they always look skinny because the line of the stomach is not longer working well. So even when you eat nutritious meal, it is when your body absorb those nutritious things that is when it reflects on your body. So that is why some people, when you see them, despite what they eat, their diet, everything, they still look skinny. So that is one of the major signs of peptic ulcer. Then another thing is that some do have dark or black stool. Like when they go to toilet, that toilet is always dark. Maybe they didn't eat vegetable things or something like liver. You know, there are some things that when we eat, there are some drugs that when we take, they will always affect the color of our stool. So when you don't eat things like that, or beetroot, that kind of food, and your stool is still dark, you know, is indicating something. And it would be nice to run a test called the occult blood, that is hidden blood, to know if there is blood in that stool. Because when you have ulcer, that person will be bleeding from the walls of the intestine, but this blood is hidden in the stool. You cannot see it on naked eyes. It is when occult blood test is being done on that stool, that is when you will detect that there is blood in this person's stool, and it's a very big sign that the person has peptic ulcer. Another thing is severe burning pain. People that have peptic ulcer generally they do have burning pain, but when it is severe, then it's a strong sign of peptic ulcer. So that is for the signs and symptoms of peptic ulcer. Okay, then another thing is the laboratory diagnosis. Okay, what are the tests that can confirm that someone has peptic ulcer? Like I mentioned earlier, Helicobacter pylori test is very important to know if that bacteria is in your blood. Okay, then another test that can be done is upper endoscopy. So scan can also be done to check the line of the stomach, how it is. Then another vital point is the management of peptic ulcer and treatment. When it comes to management, some people's ulcer do heal on their own. So I will tell you that I used to have ulcer before, but I'm no longer feeling it again. Yes, it's normal. Sometimes when your immune system is very strong, the ulcer can heal on their own. But we also have to know that peptic ulcer, in as much as it's a very simple something, okay, it's not something that we should ignore or say it's nothing. If you discover that you have ulcer, please treat it very well, because if not managed well, it can lead to bleeding. Okay, there are some people that they will tell you that they were vomiting blood before they died. Some will tell you that the person was stooling blood. You will think that it's poison. It's not poison. Ulcer is very bad, okay, if not managed well. It can also lead to perforation, like a hole through the wall of the intestine. Ulcer can also cause that. Okay, so a lot of things can result from peptic ulcer if not treated well. Okay, so when it comes to treatment, if it is that Helicobacter pylori that actually caused the ulcer, with antibiotics, okay, doctors will be able to treat the ulcer very well. Okay, and there are some that you just have to manage it. There are some ulcers that you don't have any other thing than to be managing the treatment. Okay, that is, they can't heal again. Just place yourself on management drugs. Then doctors can use proton pump inhibitors. They can use histamine receptors blockers, okay, and antibiotics to treat this ulcer. So why am I doing this video? The essence of this video is that if you have not done that Helicobacter pylori test, it is abbreviated H. pylori. Okay, if you've not done that test before, it is very good that you do it. Okay, so that when you discover that you have this bacteria on time, because some people they have it. If you should run 10 tests now, 8 of them will be positive for Helicobacter pylori, 2 will be negative. So this bacteria is very common. So with time, to start eating up the lining of the stomach. Okay, so it's very important to always do this test, which acts as a screening test mainly for this peptic ulcer, so that if it is there, they can start treating it on time and it will not develop to a length of seeking for higher medication. So that is why I said I have to make a video on this peptic ulcer and throw more information on it, because in one of my videos where I debunked some myths with you guys, I also said that peptic ulcer is not being caused by spicy food, that is being caused by H. pylori. So I said, let me use this video to explain more on that peptic ulcer. Thank you and see you in my next video. Bye.